A production fee for your Hometown Health Connection was made by Buffalo Healthy Living Magazine and its sponsors.
Here are some startling stats about diabetes. In 2018, 34.2 million Americans, that's over 10% of the population, had diabetes. Nearly 1.6 million Americans have type 1 diabetes, including almost 190,000 children and adolescents with over 7 million undiagnosed. Over 14 million seniors, 65 and older, both diagnosed and undiagnosed, are struggling with diabetes. On this edition of your Hometown Health Connection, we will get information you need to know from a doctor, dietitian, and pharmacist from General Physician PC. I am Kate Glaser. Welcome to the program. Today you are going to hear from Dr. Richard Charles, Chief Medical Director of General Physician PC, Kelly Cardamone, a registered dietitian, nutritionist, and certified diabetes care and education specialist, and Samantha Will, Director of Pharmacy Services at General Physician PC. Established in 2010, General Physician PC has grown to become one of the largest medical groups in Western New York that consists of some of the region's most respected and accomplished healthcare providers from many different areas of medicine. We begin our conversation with Dr. Richard Charles. Welcome back as a guest on our program.
Thank you for having us back this afternoon.
Thank you so much. Dr. Charles, can you talk to us about the different types of diabetes and tell our viewers the difference between type 1 and type 2 diabetes?
Sure. So type 2 diabetes is by far and away the most common type of diabetes. It's typically a diabetes that onset is in adults and older individuals. It represents 90 to 95% of all diabetes. Type 1 diabetes tends to be an earlier onset and is a different disease. It typically occurs in youth and occasionally in older individuals. Of course, there's also gestational diabetes and prediabetes, all of which are also very important, particularly prediabetes, which we hope to spend some time talking about this today.
Absolutely. What causes type 2 diabetes versus type 1? Talk a little bit more about the background of each different type 1 and type 2 and how that impacts people.
Sure. So type 1 diabetes is a disease that is an insulin deficiency. So typically something happens, an insult to the pancreas, and there's not enough insulin to keep up with what the body's needs are. Typically is an onset in youth. It often occurs after a viral illness. Type 2 diabetes is a different illness altogether. In fact, type 2 diabetes is often associated with many other health conditions: high blood pressure, high cholesterol, overweight, obesity. And what happens is actually your body doesn't have enough insulin relative to its requirements. So there often is a resistance to the effects of insulin on the tissues, both the muscle, the fat, the liver. And so what happens is your body behaves as if there isn't enough insulin, and so your body goes through a number of changes related to that. And again, it purports cardiovascular and cerebrovascular risks. So it's a very interesting concept that these things all tend to run together: diabetes, high blood pressure, high cholesterol, and excess weight.
Okay, and talk about prediabetes. You use that term. What does that mean for viewers watching right now?
Absolutely. So prediabetes is kind of the step before diabetes, and it's an extremely important area because as a person goes from being so-called normal to being pre-diabetic, again, it's this concept that these things run together. There's more vascular risk: heart attack, stroke. What happens is a person begins to have some changes where their body may be more resistant to insulin. So really looking at what lifestyle changes can occur, exercise, weight loss. Also, is there medication specifically that can impact that kind of process from being normal to pre-diabetic to diabetic? Again, as we go towards that pathway of diabetes, if we can stop or arrest that process, we reduce vascular risk, we improve people's lifespans and their quality of life by having less complications associated with these illnesses.
Talk about the danger of prediabetes, type 1 and type 2. What are some of the things people should be aware of and the impact of diabetes on someone's life?
Right, and I tend to break things down into three. So I think there's three what I call big blood vessel risks. There's stroke, heart attack, and then vascular disease in your legs. Those are the big blood vessel consequences of these illnesses. The small blood vessel consequences are vision. It's the number one cause. Diabetes is the number one cause of loss of vision. Renal failure, or kidney disease, and then also nerve damage or neuropathy. So these conditions all have very significant consequences for people.
Is it possible to reverse prediabetes?
And I think that's exactly right. You can at least arrest it, and there's some concept now not only arresting or reversing prediabetes, but also diabetes in general. When is diabetes in remission? And I think a lot of what that involves is managing the other risks in one's life. What is your weight? What does your diet look like? And all your other medical conditions, blood pressure, cholesterol, that sort of thing.
I know my father was diagnosed with diabetes, and so was my grandmother, and so was my brother. So diabetes is a very common thing in our family, unfortunately. There's a misconception maybe that it's genetic, or maybe it is genetic related. Can you talk more about kind of what, I know that an unhealthy diet obviously impacts diabetes, but anything else that goes into that?
Absolutely, and there is definitely a genetic link with type 2 diabetes, and I think that being the number one type of diabetes, there's clearly a family predilection, as you've mentioned. But I think there are things that we do every day that impact that, our lifestyle. How do we do with our nutritional choices? How much exercise do we get? What other medical conditions have we developed as a result of those choices, and our genetics as well? So these things all kind of interplay. I think what we're really talking about is overall vascular and cardiac and neurologic health.
Okay, and according to the National Institute of Diabetes and Digestive and Kidney Disease, knowing your ABCs is important. Talk about the ABCs. Obviously, I know what ABCs are. I have 3 young kids, but talk about the ABCs in terms of diabetes.
And I think that's a really great concept to give to patients. The A is the hemoglobin A1C. What is the hemoglobin A1C? It's a measure of average glucose over 3 months. So it's not just highs and lows, but it's the total average over 3 months. It's a critical number. Good control is under 7. There's evidence in early type 2 diabetes having the number lower than that, 6.5, may be protective long term. B is blood pressure. What is your blood pressure? Depending on your other comorbidities, there's a specific number. Is it less than 130/80? It depends on other comorbidities, but a very important thing. The last thing is cholesterol. What is your total cholesterol? What is your good cholesterol, your bad cholesterol, your triglycerides? Again, it gets back to what we were talking about earlier. These concepts or these conditions all kind of often coexist, and they all relate to each other with lifestyle and diet changes that we make through our lives.
Okay, and if you decide that a patient is either diabetic or pre-diabetic, what happens next in terms of their course of treatment?
Well, it's very important, number one, to assess where they are. What is their A1C? What is their actual fasting glucose? What is their cholesterol and their blood pressure levels? Do they have damage in their kidneys? There's a way to measure proteinuria or protein in your urine. Do they have a normal foot exam? Have they had their eyes checked to make sure there's no changes there? And then you really take a very sound history. What is their dietary history? What is their exercise history? And one of the really great things about general physician is that we have the opportunity not only to come see your doctor, but we have a dietary team that does nutritional consultations, they do diabetic education, and they can really help wrap your health around these issues. Additionally, we have clinical pharmacists. Are you on the right medications? Is there a way to use medications to lower vascular risk, to help you with weight loss? And so I think when a patient looks at their overall care, their overall health care of diabetes, it's kind of linking all these things together. It's the clinician, it's the dietary expert, it's the pharmacy and the medications, and there's a whole other piece, the exercise piece. Where are they getting exercise? Are they getting 30 minutes a day? So these are kind of the things that we kind of use as cornerstones to look at a patient with diabetes.
And obviously lifestyle is so important for someone someone who doesn't have diabetes but could be having it down the line.
Absolutely, and I think if you ask about delaying diabetes or reversing prediabetes, again, if you manage your lifestyle, do you lose 7 to 10% of your weight? That has a huge impact. Are you moving 30 minutes a day? What choices are you making? Are you eating more fruits and vegetables and less processed food, less processed carbohydrates? There's so many choices you can make, and I think people know about nutrition, but I think when they hear it from an expert, I think today we'll hear from Kelly, I think you really can get a sense of just how important this is in your overall health, not just in diabetes, but all your other health conditions.
I was going to say, for someone watching who maybe doesn't have diabetes but has a family member who has diabetes, what sort of help can they get? Where can they turn to for hope and where they feel like they really need it?
All right, and I think there's a lot of different opportunities. I think you look at the American Diabetes Association, there's a lot of information available there, both online and in some of their localities. You look for an education program in your doctor's office, like we have a diabetic education program and a dietitian. You look at what services are available from your insurance, because many of them offer health coaching. I think what you have to do is kind of almost like financial planning. You have to health plan. How do you manage your nutrition? How do you manage your exercise? Are you on the right combination of medicines? And put this all together and kind of develop a plan to maintain and improve your health over the course of your life.
And one final question because I'm curious. Is there an age that people should start looking for, maybe they have diabetes, or can it happen at any age?
I think, again, if you go and see your doctor as an adult, but typically over age 35, you really should be asking, how frequently should I be screened for diabetes or prediabetes? How frequently should I be seen for my cholesterol? What are my numbers? And really, that should be part of any good discussion. Again, also, what is your blood pressure? Is it within the range? What can I do to improve these issues, short of medication or with medication or with available resources in that practice or where they're getting health care?
Wonderful. Well, thank you, Dr. Richard Charles, for your insight into diabetes. We will return to continue the conversation right after we tell you how you can connect with our guests. If you want to connect with Dr. Richard Charles, Chief Medical Director at General Physician PC, you can give his office a call at 716-248-1420. Dr. Charles sees patients in Buffalo, Williamsville, and Orchard Park. You can also find out more information online at gppconline.com. We will be right back to continue our important conversation about diabetes after this short break.
Buffalo Healthy Living magazine is a free, full-color magazine distributed throughout Western New York. Now, more than ever, as we all want our families and friends to be safe and well, Buffalo Healthy Living magazine is devoted to health, fitness, and nutrition for people of all ages. It's a great read and also has great recipes. Pick up Buffalo Healthy Living magazine all over our hometown or go online anytime at buffalohealthyliving.com.
Continuing our conversation, we welcome Kelly Cardamone, a registered dietitian, nutritionist, and certified diabetes care and education specialist, and Samantha Whale, Director of Pharmacy Services at General Physician PC. Kelly, Samantha, so nice to have you guys. And Kelly, what role does diet have in preventing diabetes, helping those with prediabetes and diabetes?
So eating healthy helps with diabetes and prediabetes, but it actually helps with all of those ABCs that you had discussed earlier. So by eating healthy, we can help to control our glucose levels. We can also help to control blood pressure as well as cholesterol levels. So we can reduce those risks of if someone's becoming diabetic or if they're in that prediabetes stage. But then it can also help with weight management and weight loss.
Okay, so it's very important to start early and really tackle that.
Absolutely.
Okay, and Samantha, at what point is medication typically prescribed by a physician for a patient in order to manage their diabetes or prediabetes?
So I think it's a really personalized decision that happens with the patient and the provider, and certainly when we work with patients. Usually if their A1C comes and it starts to be over 9, we reference the A1C being one of the ABCs, that's usually when we start to realize that this might not be a diet alone issue. They might need more help with a medication. And so usually what I tell my patients is, we want to start a medication so that when you diet, we can see you be successful with lowering your numbers, because it's definitely a combination of the two.
Okay, and meal plans, they're so important, Kelly. A lot of people, even in my circle, my friend group, my family group, talk about meal plans and the importance of it. So talk about how you sort of walk that through with a patient and what you have to be looking for.
So when you're looking at meal planning, so first and foremost, there's several things that you're going to look at, but you look at their medical history. So what are we trying to manage? Again, are we looking at diabetes? Do they have high cholesterol? Do they have high triglyceride levels? Do they have coronary artery disease or heart disease? But then on top of just that medical part, you have to look at what their home life is like. So I look at, do they have other people in the household that they are cooking for, have to take into consideration? Do they have children? And then you also have to look at their food budget. So not everybody has unlimited food budgets, and some people are on SNAP or food assistance, and you have to take all of those factors into consideration when you are developing a food plan specific for that individual. And above all, you have to find something that someone is willing to stick with.
It's so important too, and that's a good thing you bring up, is that healthy food is sometimes more expensive, right? So keeping that in mind is so crucial.
Absolutely, and unfortunately it's a misconception that eating healthy is more expensive. So I work with patients to go through, and I teach label reading is really important. So I tell them, do not look at the package. So you really want to look at the nutrition facts panel, and you need to actually dive in and look at that, the sugar content, the fiber content, the saturated fat, the sodium levels. So teaching them to do that takes away from that marketing aspect of a lot of foods. And then I really kind of gear them towards foods that can be less expensive, like beans, legumes, brown rice. Also, frozen vegetables are a great option. So you can eat healthy still on a limited budget.
Okay, and Kelly, how do you accommodate cultural or ethnic food preferences so that people don't feel deprived, but they're also keeping in mind their culture?
So same thing would be is when you deal with anyone and looking at, developing a food plan for them, is I actually will ask individuals, so what foods are very specific to your culture that are really important, that you eat on a regular basis? And then a lot of times I will take a recipe and then I do modifications. So instead of using one ingredient, I may look culturally at what they're used to having or implementing into their diet, and we actually might do substitutions. But you always have to take that into consideration.
Is there any time that dessert is okay, even if it's small? Right?
Absolutely. So I really try to focus on 80 to 90% of your diet should be really healthy, but you have what I call discretionary calories. You don't ever want to feel deprived and unhealthy, and I don't even like to call them unhealthy foods, but sweets and things along those lines and desserts still have their place in anyone's diet.
Samantha, can you talk about the importance of adherence in taking medications and controlling diabetes?
Yes, absolutely. So taking a medication it only works as it's supposed to if you take it the way that you're prescribed. So oftentimes I see that non-adherence to medications leads people to actually maybe be prescribed more medications than they need, because you might not be taking the medications that you have the way that you should, and with that they're not controlling your chronic diseases the way that we want them to. So I always tell patients, it's important to make sure that if you're having, like we mentioned, side effects, or if you're having difficulty getting a medication into your routine, especially if it's something that's prescribed 3 to 4 times a day, to make sure you're talking with your doctor, talking with your pharmacist, so we can come up with a solution that works for you.
Are there any strategies with taking different medications that you can talk about?
Yeah, so we usually recommend patients purchase a pill box. It's a nice visual tool where you can organize your medications, by day, and then certainly by time category that you're taking them. It's nice to be able to go back when you fill the pill box once a week and see, okay, I might have missed Tuesday morning's dose this week, and you can use that as a mental reminder to maybe work to try to improve adherence during that time frame. I also tell patients, if there's not little children around, to leave pill bottles somewhere that might be easily visible so that they can see it, and it reminds them, like the kitchen counter, maybe next to the coffee pot, depending on the type of medication, in the bathroom by the sink when you go to brush your teeth. So setting an alarm is sometimes very, very helpful to trigger patients to remember to take their medications the way they're prescribed, and we can certainly work with patients too to develop a customized plan if none of those fit.
And Kelly, this is something that I'm so interested in, is these diet fads. There's so many out there, misconceptions, details flying around. How do you decipher between all this information?
And that is a great question, because many times I feel half of the time I spend with patients is trying to help them weed through what's fact and what's fiction. I do often make the joke that you've got superstars and Hollywood stars and your next door neighbor. Everybody has written a book on health and diet, and everybody's come up with a supplement. The bottom line is all diets work, and they do. But I don't like to call it a diet. It should be a way of living and a lifestyle. Unfortunately, you've got 2/3 of the population that's overweight and obese, and a lot of individuals are looking for a quick fix. So they're looking for that diet to really kind of, for the most part, get the weight off, or they've read, with diabetes that they're going to follow this diet and it's going to go away, which it does not. So the biggest thing is to really just focus on overall healthy eating and focusing on whole foods and even implementing good fats and lean proteins and steering clear of those diets. Because unfortunately, those diets don't address medications, medical history, concerns, and all of those things I talked about earlier, taking the whole individual into consideration. And so I really try to stay away from those, and I tell patients to stay away from those as well, because you usually don't stick with it long term. It's not a lifestyle change.
So the Mediterranean, the keto, the plant-based, those are sometimes not necessarily the best things to follow, correct?
There are some that are better than others. The Mediterranean diet, I think, is an overall healthy diet. It actually also has, we have to look at scientific data as well. I remind everybody that nutrition is a science. It is not an opinion. Unfortunately, that's what it is. A lot of times there's a lot of anecdotal information. But the Mediterranean diet has been shown to help reduce the risk of heart disease. It's overall a healthy diet. A plant-based diet as well has some good research behind it, that it has potential to help reduce the risk of heart disease, control diabetes, obesity, weight loss, because those diets are a healthy approach to eating and they don't necessarily eliminate food groups. Any diet that eliminates a food group, like whole grains, vegetables, fruits, is definitely a no in my book with my patients.
So is that a plant-based diet that includes no meat, correct?
Absolutely.
Okay.
So a plant-based diet, there's many different descriptions of a plant-based diet, or vegetarian or vegan. The one I really like, it's a whole food plant-based diet. So you really minimize processed foods in your diet. So you're doing, you're eating things like fruits and vegetables, but it's not just fruits and vegetables. It's whole grains, brown rice, quinoa, whole wheat pasta even. And then on top of that, those nuts and seeds and lentils and legumes and beans, and it really is focusing on foods in their natural form, and really can be satisfying and flavorful and really healthy with fiber and phytonutrients, antioxidants, and so forth.
I'm a vegetarian, so this is really good information to hear about, because a lot of times I go to bed at night and I'm starving because I don't really have that protein. So is there anything that you recommend to kind of get that natural protein?
So proteins, I love tofu, and a lot of people will say they don't like tofu, and the question I usually ask is, have you ever tried it? And then it's usually no. So don't be afraid of tofu. There's a lot of great recipes out there. There's a tofu scramble. I've done it in tacos. And also you can get it from nuts, seeds, beans. Even try some of the pastas that are lentil pastas. They tend to be higher in fiber and protein, but those are great sources of protein as well. The website that I really like for these plant-based recipes is forksoverknives.com. There's a lot of great recipes for the family as well that are plant-based.
Wonderful, thank you so much. Samantha, why is self-monitoring blood sugar level at home so important?
So like Dr. Charles mentioned, so an A1C looks at the big picture of how your blood sugars are controlled over a 3-month period. But what it does is it looks backwards. So if you got an A1C check today, it tells us how your blood sugars were doing the 3 to 6 months leading up to that lab value. One of the things that I think is most important for patients to realize is once you've made a change, once you've made a lifestyle change, once you've started exercising, once you've changed the foods that you're eating, or maybe we've started a medication, that A1C is not super relevant anymore. And the fact that, like I said, it looks backwards. So blood sugar testing at home is very, very important, because while an A1C tells us how you were doing, testing your blood sugar daily tells us how are you doing, so that we can be nimble with respect to how we pick medications for you, or it really dictates what step we take next. So I can't stress that enough to patients. It helps you stay on top of how you're doing, and A1C should never be a surprise when you go into the office, because you should have blood sugar readings that kind of give you an idea of how you're doing before you get there.
Are there any signs that kind of give you the thing that you should be checking, maybe blurry vision or things like that, where someone really should be checking their blood sugar?
Yeah, so the body is designed to tell you that something is wrong when it's happening. So I always tell my patients, there's warning signs that you should look for when you're, too high on the spectrum or too low, right? Your blood sugar can't be too high, it can't be too low, it needs to be just right. So signs and symptoms of a low blood sugar could be you feel shaky or dizzy or sweaty or hungry. Usually we like to have patients check if they're having any of those symptoms to see if it's related to your blood sugar, or if you have something else going on that might warrant another look. On the other side of the spectrum, we like to tell patients, when you're having a high blood sugar, sometimes those are very non-specific. So they might feel tired, they might be urinating more frequently than normal, thirstier than normal, sometimes hungrier than normal, or they could have vision changes. And so in any of those symptoms on that spectrum, it's always advisable to make sure that you're checking, just to make sure that your blood sugars aren't very, very high or very, very low. And then certainly daily monitoring is important to make sure that they're stable in the in-between.
We talked about diets, now I want to talk about exercise. How crucial is exercise in someone's life?
Extremely important. And I think that individuals underestimate how powerful that exercise is. I actually tell all of my patients, and even when we do the diabetes classes, do not look at exercise as a way to lose weight. And that's where a lot of people get frustrated, because they're exercising, eating healthy, and then they're not losing as much weight as they anticipated. So I say, put that aside. Actually, weight loss primarily is going to be diet anyway, but exercise is important for heart health. You have diabetes, you're 2 to 3 times greater risk for heart attack and stroke. Exercise is a way to help manage that or help reduce that risk. It helps you sleep better, helps with stress management. Maintaining your lean muscle mass actually also helps improve insulin resistance. And unfortunately, as we tend to get older, is when strength training, people tend to do it less. And I will tell patients, really look, at walking every single day, even if it's 10, 15 minutes. And if you find that that's too much, start with 5 minutes. Do 5-minute intervals several times throughout the day. But then you also should be implementing some sort of strength training, whether it be with light weights, TheraBands. Take advantage of the facilities that are out there that actually offer even classes, group classes, silver sneakers, things along those lines. But it is extremely important, and it helps to reduce your blood glucose levels because the body uses glucose for energy as you're exercising.
I think people think because they're not going to a class at a gym that they're not exercising, but you said like walking 5 minutes is so crucial.
Absolutely. A lot of, if you have equipment at home, just getting outside, taking advantage of the mall to even do mall walking. There's a lot of things that are available on demand, on TV, a lot of videos that can just, 5-10 minute videos, and you can even go up to an hour. It's just getting yourself moving. I tell people put music on and dance around the house, take the stairs, all of those things, just keep the body moving is really the best advice.
Before we close out, you have diabetes classes. Talk a little bit about that and why they are so important.
One of the things that we offer at General Physician are these diabetes classes, and I'm very proud to be the coordinator for them because they really are successful and impactful, and Sam and her team are a big part of them as well, is they are very comprehensive. And so patients come away feeling empowered. We currently now have a 4-week course, and every week you come for about 2 hours. And the first week they learn the difference between type 1 and type 2 diabetes, as you had discussed with Dr. Charles. And we talk about kind of what happens in the body, explain insulin. Then we get into the second week is all about food and nutrition and how that can impact your diabetes, ways to eat healthy, modifications in recipes, things like that. The third week is we have somebody from the pharmacy team that goes through all of the medications and answer questions so patients really have that knowledge. And then we actually finish up with exercise, stress management, and sleep. We really cover everything about diabetes so patients have that knowledge and they feel like they can really, they have its power and they feel like they can control their diabetes or to help control it, so it's great.
Thank you, Kelly and Samantha, for being here. I learned so much from you, helping us understand diabetes and what we can all do in our everyday lives. Thank you so much. Our guests offered some important information about diabetes, but I'm sure you may have some more questions or need to connect to seek assistance for your situation. Here's what you need to do to connect with Kelly Cardamone, our registered dietitian, nutritionist, and certified diabetes care and education specialist. You can call 716-631-8400. Kelly sees patients in Amherst and Buffalo. For Dr. Richard Charles, the Chief Medical Director at GPPC, you can call 716-248-1420. He sees patients in Buffalo, Williamsville, and Orchard Park. And for Samantha Will, Director of Clinical Pharmacy Services at GPPC, you can find out more online about pharmacy services and for all of our guests at gppconline.com. Thanks for watching. Be safe and be well.
A production fee for the preceding presentation of Your Hometown Health Connection was made by Buffalo Healthy Living Magazine and its sponsors.